So what we're going to show you now is a little stretch for your rectus femoris, your psoas, iliacus, and your TFL. These are your hip flexors, commonly get ramped up. Pretty much anybody, even if you're just a desk jockey, you're sitting a lot of time, these muscles are in a shortened position. If you're somebody who runs a lot, these muscles get a lot of strain put on them. So it's important that your hip can open up so you can actually activate your glutes properly and get a full stride in a run. So what we're going to show you is how to get into position here. So she has her knee on the pad, foot elevated on, we're using a bench, but you could use a couch, a bed, a chair behind you. Now the most important thing is we're trying to keep a neutral pelvis and a neutral spine when going into this position. So notice her butt is pretty far away from her heel here. We're not trying to get the heel to the butt, we're trying to open up the hip. So a way to accentuate that is by trying to squeeze your glute or your butt muscle on the side you are stretching and exhaling all the air out of your lungs to help engage that core. Okay, it should increase the stretch. Now the other thing you want to make sure is that your knee is not flared out to the side. What I mean by that, we want your knee in line with your hip. I'm going to move the camera here, bear with me. If we look at her from the front, we want that knee directly underneath the hip. We don't want it flared out to the side. So same thing here as our other stretches, hold them for somewhere between 30 seconds to a minute, about twice each side. This is a classic exercise I see a lot of people doing. It's an oldie but a goodie. Unfortunately, very commonly performed incorrectly. So what we're going to show you here is the proper way to perform a glute bridge. So what I like to use is a towel, a pillow, or a small ball placed in between the knees. You want your knees bent somewhere around 90 degrees. I like to have my patients and clients reach towards the ceiling with their shoulders so you feel your shoulder blades start to round off the floor or mat. And I also like to have them take a breath in through their nose and then exhale out all the air they can possibly get out of their lungs. This is how we set a good stable core before we go anywhere. So once we're here, I encourage them to hold that contraction, don't hold your breath. Make sure your back feels relatively flat to the surface beneath you. And you're going to press through the heels of your feet to lift your hips up. Now, you are only lifting up as high as you can without losing that core contraction. If you feel your ribs start to flare, your back start to arch, you've gone too high. I like to have people pause at the top to accentuate that contraction, help lengthen the psoas, the iliacus, the TFL. Gives them a chance to relax and turn off. We'll make sure we keep those ribs down. Nice reach to engage the serratus with the obliques. Good solid pause at the top. That's perfect. Now, just for the sake of explanation, we're showing you a bad bridge. Go ahead, give us a few reps of that. See a lot of people really loading up when they do these bridges too. A common thing I like seeing a lot of people do is putting dumbbells and barbells across their hips and they start doing bridges with it. I used to be guilty of this, so I can't criticize, but as you see here, she is not maintaining a neutral core. We're getting just as much back extension as we are hip extension. Actually, we're getting more back extension rather, and we're not actually achieving true hip extension here. So we're not challenging the psoas, iliacus, and TFL to lengthen. You're going to get a lot of shearing here at your lumbar discs and a lot of strain on the facet joints. So before you go and load up your bridges, make sure you can do them properly as we demonstrated previous to this. So this is a real simple exercise I like to use to help people find their hip external rotators, so those deep six muscles and the external rotation fibers of their glute max. We're taking it from this angle so you can actually see the lack of motion that should occur at the pelvis and where we want your knees lined up when we do this, okay? So hips and knees should be bent to about 90 degrees in this position. We want to take our top knee and have it slightly in front of our bottom knee. And we want to make sure it stays there the whole time, okay? So from here, keeping that top knee forward, gently try to raise it off your bottom knee about 2 to 4 inches. We're just going to hold. Don't worry about how high you lift. It's more important that your pelvis does not move as you raise that leg. We do not want your hips to rock back or your pelvis to twist. If you are feeling a contraction down the back of your leg, in the front of your hip, you need to reset and try again. We're going to go through some troubleshooting people have with clamps. So go ahead, go back down and relax for me. So let's say you felt that down the back of your leg or in the front of your thigh. Another cue I like to use with people is to have them tuck their tailbone underneath them like a dog tucks its tail in between its legs when it's scared. So maintain that tail tuck, knee stays forward, go ahead and lift. We're going to hold again. We're going to try holding for about 10 seconds again here. Again, you should be feeling this in your glute, the outer back part of your hip. Go ahead, go back down. Now let's say you're still not feeling it. Another cue I like to make sure I use with people is to make sure their feet are nice and relaxed when they're doing this. Okay? You should not be using your feet to help you lift your legs. So let's go again, knee forward, tail tucked, and lift. Good, back down. If you're still having a hard time finding that glute muscle, let's take your right hand here, and I want you to slide it under your side. Okay? And what I want you to do is create a little tunnel for that hand using your abdominal muscles. So a little tunnel, tailbone tuck still. There we go. Top knee in front of the bottom. Lift it up a few inches. Good. And back down for me. Now, if all else fails and we still aren't there, the last thing I would try adding is hugging the arch of your top foot down into your bottom foot. So the arch of your top foot down into your bottom foot. Knee forward, tailbone tucked, tunnel, and lift. Now with these clams, I like to have people do holds for 10 seconds. The reason why is because I find a lot of times when you load them up with bands, it's a good thing to do once you know you can find your glutes. It's a problem if you can't find your glutes and you start using the wrong muscles and you're loading a faulty movement pattern and you're loading the wrong muscle. So you're creating a bad habit basically for your body and perpetuate some faulty movements. So make sure you can find your glutes doing these clam isos before you start putting bands around your knees. So this is a variation of another hip external rotation exercise. I like to call this a closed chain clam. I had another trainer term it the Tootsie Roll because it looked like the dance move, the Tootsie Roll. So without any more, here we're going to show you the Tootsie Roll. So if you can get into a little quarter squat position for me. Feet are going to be about shoulder width apart, armpit width, somewhere around there. We want our tailbone slightly tucked under. I like to cue people more with the rib cage pulled in so they don't over tuck and go into any lumbar flexion. From here, what you're going to do, you're going to keep one knee in place, and I want you to pull the other knee out to the side. Fall in, pull out. Fall in, pull out. Now the trick here is we do not want your other knee to move at all as the other knee is pulling out to the side. Do not let it shift out. I like to have people do somewhere around 10 to 15 reps on one side and try 10 to 15 on the other. Let's say you got 15 already, and let's show both at the same time now. Perfect. So again, when you're doing this exercise, you should be feeling this in your glutes, the back outer part of your hips. You might feel your quads working a little bit here because you're holding a quarter squat, but really this is designed for the hip external rotators.